All righty, we are back here for our last sit and sip session of 2021 MAB. This is our 12th annual. We've been doing this for 12 years, 12th annual Medical Aesthetic Bazaar. And this session is all about CoolSculpting and EMSCULPT. Melanie and Rachel are going to be chatting about these two procedures that go kind of hand in hand, just like these two besties sitting here. And before we get to that, again, we do have a giveaway. This is our last sit and sip giveaway for this MAB. It's the free EMSCULPT treatment. That's worth $750. So definitely worth taking the time to watch, learn, and see if you can win. So go ahead and in the comments, leave us your, let us know that you're here. Let us know that you would like to be entered for that. Also, if you have any questions, please go ahead and leave those in the comments also, because we want to make sure we address any questions you have about these procedures that are both discounted along with many other products and treatments during MAB this whole week. So lastly, info@empireinlaser.com is the email address. So if you're not able to comment right now for some reason, you're not logged in or one reason or another, you can also just shoot us a quick email and let us know that you are here and that you would like to be entered. So my rambling is over. I'm going to hand it over to Melanie and Rachel, and they are going to take it away.
Hey everyone, thanks for attending again. Super excited to get to talk to you guys about CoolSculpting and EMSCULPT, and then stick around and we have a free EMSCULPT treatment for you to win. So we have Melanie here and she's going to be chiming in and helping me out. So first we are going to talk about how CoolSculpting works. So all of us have some stubborn areas that diet and exercise does not work. So we have CoolSculpting technology that can cool targeted areas and kill these fat cells. So in the weeks to follow, the body will naturally process the fat, just like if you were dieting, and then the results are permanent or long-term. So we've got some great results.
Well, I want to say real quick that by adolescence, we have a finite number of fat cells in our body. So they just get larger and smaller when we gain and lose weight. So when we do CoolSculpting and we kill off the fat cells in the treated area, they really are permanently gone. However, there's a caveat. If you gain a significant amount of weight, your fat cells are going to get so large that they're going to reach what we call a critical capacity, and they're going to split and create more. So CoolSculpting is great for somebody who's sort of in their ideal weight range, planning to stay in their ideal weight range and working to stay there or lose, obviously. But if we go gain 30 plus pounds and we take that quarantine 15 times 2, then you might actually undo your CoolSculpting results. The same that you would undo your liposuction results with surgery or tummy tuck. You can get your more fat cells by gaining a significant amount of weight. So this is not a license to eat.
Yes, nothing is a license to eat, I don't think, but okay. So first we will do your consultation, and we want to plan a treatment for your specific goals. So definitely very important to us, and something.
The consultation is really important because it's so customized. We have different applicators, different sizes, and you might have areas of concern that aren't great treatment options, but maybe you didn't recognize another area was a great treatment option. I can't on Instagram tell you to purchase how many cycles of CoolSculpting. It really is very dependent on what you're presenting with. And so we want to see patients in the office because we want to make sure that we're setting up the right consultation and the right treatment plan. Now, on that note, if we haven't already met you and haven't already set up a treatment plan, if you look at the specials that are listed online, they are cleverly named by body area. And that's a great starting point just for having not met with each other. When you come in, we would have an opportunity to look at what you decided to purchase. And we can customize things if we need to, if we're going to change anything around from that package. But I think if you look at the names of the package, you know kind of what you want to do and where you want to treat, that's a good starting point.
Absolutely.
For being able to take advantage of the specials.
Yes, I completely agree. So treatment day is very simple. Treatment is very simple. We watch a lot of Netflix. Mm-hmm. We can have champagne. It's an easy treatment to go through. And here are some of our results. So this is one of our actual before and after patients.
Yeah, I mean, great. I think great before and after, because she's thin, she exercises, but those flanks she just couldn't lose. That's where this is a good option for targeting the areas that you just can't get rid of with diet and exercise.
Great photo. And this treatment I really like because it shows you the company recommends 2 treatments in every area. So this shows you an 8-week photo after her first treatment, which was kind of just a debulking treatment to kind of help that lower abdomen area. That is a tough area for all of us. And then the second treatment came back in and did a complete treatment. And you know, I might say she looks like she's dieting too because she looks fabulous, but it was a great treatment.
Yeah. The 2 treatments is important because that first treatment might be like, yeah, I see some results, but that second treatment is more that wow factor where it's more apparent to everybody else.
Yes, but you could also still have a third treatment.
And you can add more. So you might feel like you've gotten really great results after the second and you're not, and you still would like a little bit more. We do have additional package pricing built in if you choose later within a certain time frame to add on third treatments. Again, part of that customized consultation.
Yes.
But definitely 2 treatments is, kind of the treatment to transformation.
Yes. And this is a treatment of the arms, which is a very popular area to do. So we're just making, I'm sure I've done this. I've tried on a blouse before and it's too tight in my arms. I have had my arms done. The arms we just want to be careful about because we are going to treat the size, but we are not going to treat the skin. So if there is some loose skin in this area and there is
bat wings,
there's this little thing that kind of happens. So that may not go away, but the size will be smaller.
Yeah.
So,
and somebody who isn't currently experiencing bat wings, it's October, is probably not going to be somebody who's going to experience bat wings. But if they're already there, if you already have a lot of loose skin, maybe, and this can happen over time. One of the reasons it can happen is maybe in our previous life, we were very heavy and we've already lost a significant amount of weight and that skin is stretched out from our previous weight gain. That's going to leave more loose skin. That's really going to, unfortunately, be more of a surgical option. So we're happy to help you make that determination. We're not going to have a perfect answer, but I would suggest if you don't already have loose skin, then it's pretty safe to do. Not worry about that. If you do have a lot of loose skin, this is probably a treatment that's not going to be great for your arms.
Right. But this is a great treatment if you want your arms just to look better in a sleeveless top. It's a great treatment.
Yes.
So an inner thigh, which is another really popular area to do because that area just changes as we get older, and it is a great area.
It is. And you know what? If you're like me, the only time anybody sees my inner thighs is when I'm in a one-piece miracle suit bathing suit. So no one's really seen my inner thighs very often. However, there is a time of year that matters. The reason I bring it up is because it's cold outside. We've definitely kind of passed the swimsuit season, but our saying is summer bodies are made in the winter. So this is the time to be doing your CoolSculpting when we do 2 treatments 8 weeks apart, and then it takes up to 12 weeks from the second treatment to see full results. Well, now we're talking about next summer. So this is the time to think about it so that next summer's thighs look great in your swimsuit.
Good idea. Good idea. So this is another super popular area, the chin, submental area. And I think these results are great because you can appreciate that it's not perfect, but it definitely is better.
Yeah. I get a lot of questions about the under the chin area. And there's 2 different types of fat, whether it's lying in front of the abdominal wall or in front of the muscle, and it's kind of soft and squishy, versus the deeper fat that lies behind the muscle. Nothing besides surgery can address that deeper fat. And so I suspect maybe some of what she's got going on that's remaining there is going to be that deeper fat. But for the results, the cost, and the downtime, I think she's pretty pleased with the results that she did get.
Yes.
Somebody who has really more deeper fat. I have more deeper fat remaining after my treatment. I'm going to be more of a deep plain neck lift. That's what I'm going to need to fix that. So we got to, it's not going to be the right treatment for everybody, but letting Rachel and I squish and pinch and feel your fat is going to help you help us determine for you if you're the right candidate for CoolSculpting.
Yes, chin is a great area to do. So right here, Melanie, I kind of wanted you to address something that's been in the news lately.
Okay.
And we're really talking about CoolSculpting in the news.
Yeah. You may or may not have seen it, and we like to be really forthcoming about it. So even if you haven't, I have no shame in discussing it. So there is a risk with CoolSculpting called paradoxical adipose hyperplasia, PAH for short, where it can in fact cause the fat cells to enlarge. If this happens to you, it's like winning the lottery. So go buy a lottery ticket because it is exceedingly rare. It can be surgically removed, and it's not happened in the, I think, thousands now of treatments that we've done. We haven't had any patients that have experienced it, but with anything we do, there's a risk. And with CoolSculpting, that is the risk that can occur. Certainly we would, if it ever occurs, we will work with you on getting it corrected and taken care of. So it's something that I feel like, in my personal opinion, it'd be worth still doing the treatment, just understanding that with anything we do, there is some risk, and something that comes with more risk would be scarier. For example, Brazilian butt lifts come with a lot more risk in doing those surgeries, but the paradoxical adipose hyperplasia is very small. So it is something that you would want to just determine if it was worth it for you to take that risk.
Perfect. Let's move.
Before we move on to EMSCULPT, there's a question about underarm treatment. So how does it work? Maybe you want to talk about the attachments one more time. And
yeah, we have different attachment sizes. So when we look at an arm, and I'd show you kind of how a consultation would go, we kind of see the area that's hanging down, pick the attachment, we mark out, where the fat cells feel and are at, and we pick the right attachment size for what we want to treat. Somebody who has a longer arm might do 2 rounds under here. Overlapping. Most people are probably going to fit 1 cycle on each side. So you would, buy the arms treatment, and that gets you the arms dealer package gets you 2 rounds of treatment. If we're talking about underarm, like maybe back fat area, that's going to be another area that we can spot treat. Bra fat, which Rachel doesn't have any, but this area right here, sometimes we get that, like what bulges over our bra. That's a good area that we can spot treat. So I guess if I'm thinking you're talking about arms, because that's what we were discussing, we would we would have you in this position. We would put on an applicator that does suction your fat into it, and then we get you into a comfortable position, and we have a bunch of pillows around, and you've got a 35-minute treatment cycle. While that is hooked up, we take it off, we do a massage, rinse, wash, repeat, and do the other side.
And then have you come back 6 to 8 weeks later and do it again.
Yep.
Can you do CoolSculpting if you have had cancer?
You can, if you've had a surgery for cancer removal in the area that we're treating. That would be something that we would take into consideration. So for somebody who's maybe had a hernia surgery, when we're doing abdomen, we don't want to treat directly over your surgical scars. So that can be a factor that affects where we can do treatment.
And how long does CoolSculpting results last?
Again, they're permanent as long as you don't go gain a significant amount of weight. So around 30 plus pounds of weight, your fat cells that are staying behind are going to have gotten so large they reach critical capacity that they split and create more. So permanent results when you stay within your ideal weight range.
Okay. So we'll move right along. So we're going to talk about EMSCULPT now, which is something that's nice to do in conjunction with CoolSculpting. So it's not all about the fat. And we're going to talk about EMSCULPT. So things that make you go, Sit-ups only work the middle and upper front of your stomach. And so EMSCULPT kind of...
Yeah, so sit-ups are only achieving results in one part of the stomach. You've got to do different types of exercises to address the different sides of the stomach, different side parts and of the muscle. When we do EMSCULPT, we're doing 1 30-minute treatment that's addressing all parts of the abdominal muscles by stimulating contractions. And they're not the same types of contractions that you can do on your own. And it would take you
my favorite part. Oh, I thought you were going to say how many.
Oh, yeah, I know. So 30,000, is that what it is?
Something.
It's like doing 30,000 sit-ups in a 30-minute session. So when you're at the gym, certainly you can't do that many. Plus, you're having to do so many sit-ups, plus oblique treatment or oblique exercises and things that are going to address different parts of the muscle. In this 30-minute treatment, we can go beyond what you can do in the gym in a short amount of time.
It's a fabulous abdomen treatment. Then we can also do the glutes. So squats are another difficult thing to do, but we have a treatment where we can do the glutes,
and we've had some fabulous photos of patients that do get that definition of the abdomen that's hard to achieve on your own, that get that lifting of the butt. I mean, let's be honest.
You said abdomen a minute ago, but
well, I did mean the abdomen too, but now the lifting of the glutes. So definition of the abdomen, lifting of the glutes.
Okay.
We sag from our forehead down to our knees. So this is, and it's hard to pick all of that back up. This is a treatment that can do that. It sounds like, 30,000 squats and sit-ups would make you incredibly sore, but there's a component of the treatment that releases lactic acid from the muscles so that you're really not sore afterwards. We do recommend that patients don't exercise the treated area for a few days afterwards, just to allow the muscles to rest. And then it takes some time for those muscles to grow in their bulk and strength. So we don't see the results immediately, but it's a pretty great treatment with no downtime.
It's a great treatment. So a little bit more about how it works. So it is using non-invasive high FEM energy, which is also MRI energy.
Yeah. So high intensity focused electromagnetic energy is what's creating those muscle contractions and releasing them throughout the treatment.
And so the muscle tissue is forced to adapt to such extreme conditions. It's powerful energy because we see it working all the time. And it is remodeling the inner structure that results in muscle building and sculpting your body. So you can see, I'm going to just go back really quick so you can see that red at the bottom of that picture. That's your muscle layer. This is an example, obviously, of how that muscle has grown in its bulk and size. So you can see that it's much larger from before treatment to after treatment. It's pretty impressive. So this is one of our before and after photos. Yeah. And great results. Yeah. And this is just EMSCULPT. She did 4 treatments within a 2-week period, and these results are 3 months later. So that's usually when we do our after photos. Perfect. And so, I think that the other really cool thing about that patient is she was able to really appreciate that at her Pilates class, she felt stronger, and her instructor made a comment about her core strength. And she's like, well, yeah, I noticed it too. So it was very apparent, even to somebody who's familiar with, her strength, that she had made improvements. Yes. So our specials this week are 10% off any of our CoolSculpting packages, and they are very cleverly named, and I think detailed enough within the name to know what you're purchasing. What that translates to is the number of cycles that we can use. So that's something that you don't need to know the back end of that. Rachel and I will help figure out how to best use those cycles. And then you get 30 units of Dysport, which is a $360 value. So, I mean, what's having less fat if we're still super wrinkly? So that's great. And then our Sculpt Special is buy one, get one free, which is a really good deal. This is only offered one time a year, and it is a great deal. And starting out, we would recommend a series of 4 to kind of get best results. One treatment is good for maintenance. So once you've kind of got where you want to be after those 4 treatments, doing one treatment every 3 to 6 months is going to help maintain those results. So for our patients who have done those series, buy one, get one free is great. It's going to buy you 2 for the year. But, if you're needing to buy a package, I might buy 3 of those and get 3 free. So that'll be your initial series plus 2 more. So it'll be your whole year's worth, or at least buying 2. So you have your initial series of 4. Perfect. That's a great way to do it.
So do you already have to have some muscle building done before you start EMSCULPT? Like, do you have to be going to the gym regularly and already have some muscles, or what?
The patient who has already been exercising, building some muscles, is going to have more definition and be able to see more of an improvement. The person who's not been working out will see it, but we might not see as much of like the 6-pack and that type of definition as opposed to somebody who is already working towards that.
I just want to say my favorite treatment for EMSCULPT is the glutes. And I personally think that you can get some good lift in the glute area. And I think everyone would like a little lift in that area.
Yeah, agreed.
Okay, I don't think we have any more questions.
Okay, so we were either super thorough or
Or-
they've already done their research, which I also love.
So come see us.
Yeah. Let's see who's winning a free EMSCULPT treatment.
All right, let's pull this up and see who our winner is today. Got a lot of names on our wheel.
Mm-hmm.
Oh.
All right, Jay Horton, congratulations. Woo, I think you won something earlier in the week too. This is your week.
This is your week.
Congratulations.
Congrats.
Congratulations. Definitely go ahead and email me one more time, info@empireironlaser.com, and we will get this squared away so you can take advantage of your EMSCULPT treatment. So to everybody else, again, thank you so much for tuning in. Thank you, Rachel. Thank you, Melanie, for all of your time this week and sharing all of your expertise with folks on these live streams. We hope this has been informative for you all and entertaining as well. Definitely come in and see Rachel and Melanie if you concerns that you want to address with any of the fabulous treatments that we do here, and of course products as well. Rachel is your gal right there to chat about Zeo and everything that Zeo can do for you. So give us a call, 661-325-EYES. MAB is going on to the end of the week, so you don't want to miss out on those savings. Now's the time to go ahead and stock up on products. Go ahead and pre-purchase any treatments that you will want to be doing over the next year, and definitely save big time. So again, thank you all. Thank you, Melanie and Rachel, and everyone have a great rest of your day.